Here we go, video 2, just for you guys, about some of the things that may be hurting you that you could be doing right now. That is a common treatment that's prescribed. So this used to drive me nuts in my office, is that certain providers would give out this information, and I have to say it's from the perspective of doing their best with the knowledge that they're given. Okay, so not a lot of people are actually trained in musculoskeletal conditions. That's what, if you sprain your ligament, if you tear a muscle, something of that nature, they're trained in it from the perspective to control your pain, but not actually make you better. And so me running a sports medicine clinic, I didn't have an option. I knew that the way to get athletes and active people better was to not only take care of their pain, but actually make them functional again, right? We actually want to repair things, we want to fix things. And that's why I hope you're here too, is because you actually want to get better. You want to invest in yourself to get to the tissue management, the ankle mobility, all of those sorts of things. And you actually want to make an improvement on your body so that you can feel better for the long term. And now this is why I became one of the experts in my town, is because when people would come in, they would get home care stuff that would last and that would actually improve their condition instead of just taking care of the pain. So let's go over a couple of things that would be commonly given to you as advice, whether it be Dr. Google or your doctor, chiropractor, physical therapist, acupuncture, doesn't make a difference. One of the most common things that can be harmful to you is to take an anti-inflammatory. Now, I'll say that again, an anti-inflammatory. Anything that could be causing the inflammation to go down. That could be the NSAIDs, that could be an injection. There's all sorts of different, chemicals that can be considered anti-inflammatory for that given area. Big blanket NSAIDs. These are things that control all the inflammation in our body. And the harmful thing about that is that if we go back to these diagrams, the reason why I say they're there to control your pain is that pain is a chemical process. And so you have a plantar fasciitis, you have maybe tendon tears, some shin splints, Achilles bursitis, heel pain. All of those are a chemical process. And when you take an anti-inflammatory, it numbs that process. Okay? But what is that process there for? How do we think our body actually heals? Have you ever asked yourself that? When you tear something, what is it that fixes that tear? When you get a cut on your skin, what is it that fixes that cut? It's inflammation. And so if you're taking an anti-inflammatory, and especially a big generalized one like an NSAID or a cortisone, and you're getting an injection into that area, you are just creating a blanket pain reliever at the cost of actually fixing the problem. So, will you get temporary pain relief? Yes, absolutely. Absolutely. Short-term pain relief. Some people can't stand pain. I do get the use of all of this stuff, but there's a reason why you're watching these videos is because you probably still have some sort of pain. Maybe it's coming and going back and forth. You don't know why. You've tried orthotics, you've tried shoes, you've tried this and that stretch. But the reality is if you're taking ibuprofen, if you're taking, the NSAIDs, anything of that nature, you could be harming your body from the standpoint of not allowing it to heal properly. So there's been quite a few studies that have shown this in ankle sprains. People who have ankle sprains, they take an NSAID, they're way more likely to actually re-sprain their ankle because it doesn't allow the ligament to heal back the way that it's supposed to. So that's the big first misconception, is if you're going to take something, and obviously you want to do this as directed by your provider or anything of that nature, that whatever you feel comfortable with, you have to get it from the standpoint of short term. You have to think of the delineation between pain response and actually fixing your body. When you go to actually fix your body, We'll get into that in the fourth video. You're actually going to have a different strategy, and you want to try to incorporate pain relief and functional improvement so that the pain doesn't come back and you actually make your body better. So that's the first big blanket thing. The second misconception that we see that could be harming you is rest. Okay? So when we look at the root cause of why, doesn't matter if you have plantar fasciitis, Achilles bursitis, bunions, hammer toes, tendon tears, all of those are that dysfunctional problem because we're not using our feet properly. So now you have pain, bam, something starts, and I get the fact that you do want to lay off of it a little bit, but guess what hurts you long term? Doing nothing about it. I can't tell you the amount of people that would come into my office and they were much worse off because the concept of resting just totally tightened everything up. And yes, they got pain relief because they weren't actually getting into the things to make the body work the way that it was supposed to. It allowed that torn tissue to just relax a little bit. But in return, everything else shortens around it. So if I have a tear right here, and I pull on this end or I pull on this end, you can see how it's going to create some tension and pain. However, if I rest, all of this tissue shortens closer to that site where I have that tear. My pain goes away. But as soon as I go to move again, guess what happens? I start walking again, maybe I try to get back into running. That tissue has to lengthen back out to where it was. Guess what's going to happen to that tear site? It is now healed in a dysfunctional way. It's shortened the tissue up. And you're going to go try to walk and do things. Got a vacation coming up. You go to do it, and poof, your pain is back. This is one of the big reasons why people get long-term pain that keeps coming and going. They rest, they go do something, the pain returns. They rest, they go do something, the pain returns. Okay? So another big reason that is in coordination with rest as one of the big pushes out there is ice. And ice kind of gets this combination of what we talked about with the anti-inflammatories, but it also gets after this tissue tightness of resting. In that, oh, excuse me, ice will actually decrease that inflammation into that area and make things tighter. So again, we have the same response. Ice, I always recommend for people under 72 hours of a new injury. Anything past that, you're actually going to want to increase blood flow. And we'll get into that into the fourth video as well. Well, we want to make sure that you understand that some of these ideas out there that are common, if you look up any type of foot pain on the internet, you're going to see rest, ice, you're going to see take NSAIDs, take pain relievers, all of those sorts of things. And those are the things that tend to land people in the office for long-term foot pain, purely because you're doing yourself a disservice with those types of therapies. Now, other stuff that can be done that tends to be not nearly as harmful as those three therapies, but they tend to mislead patients into a false sense of security, and that's orthotics. Orthotics, again, are getting after just supporting your foot in an unnatural way. You're not actually fixing anything. What you're doing is you're just creating a temporary pain relief. But I saw this time and time again after the 10 years of working on people, if they would, go get into orthotics and not do anything with their feet, is that they would rely on the orthotics for their pain relief. Their feet would be now supported by an arch support. That tissue gets tighter and more dysfunctional, so it doesn't move around as much. Then they go to do something and poof, it hurts again. So, I got to get a bigger orthotic. So they get more support and they get jacked up more. Oh, great, that feels great. And they're fine for 3 months. 3 to 6 months, and then they go to do something again. Oh, it hurts again. And it just keeps chasing itself down like that. So orthotics, while they're great for very short-term relief, you have to understand that we have to get after creating function of the foot and actually fixing these problems. And especially with things like tendon tears, Achilles bursitis, all of these are signs that you weren't moving your foot to begin with, that you weren't moving it properly. And if you add orthotics, all you're doing is amplifying what caused the condition in the first place. So I hope that helps you understand some of the misconceptions. The next video, I can't wait to share with you my personal story. I have a crazy foot story to tell you. I have several broken bones and torn ligaments. That's how I became obsessed over feet, and have some crazy patient stories I'm going to share with you. That's the third video, and the fourth video coming up is going to be, what can you actually do about all this stuff? All right, take care. We'll see you in the next video.